Hello and welcome to episode 79 of Tom's Hirschsprung's podcast. I am delighted to welcome Libby to the podcast. Libby, welcome.
Hello.
Thanks so much for coming on.
Oh, you're welcome.
Now, we are going to talk about your daughter who
Yeah,
has Hirschsprung's disease.
yeah,
And with no, again, like a lot of people I meet, with no family history, family connection to Hirschsprung's or GI disorders or anything like that.
yeah.
I guess, would you like to take us from the very beginning?
Yeah, so I got pregnant with Darla and I had a bit of a rough pregnancy. I had hyperemesis, which is where you vomit a lot of times through the day. So it was already a rough start and I didn't eat for a while. So my worry was that she was going to be premature. And then we got to near the end and I had another thing called cholestasis, which is to do with your liver function when you're pregnant. So I had worries anyway about when she would be born. And then I got induced about 3 weeks early. She come out perfectly fine. Um, she actually come out not premature. She was a perfect weight. She was 6 pound four, and she was just perfectly fine. And then when we got put on the ward, I just noticed this green stuff that she was spitting up, and it looked like phlegm from an adult, which is obviously strange. So I kept asking the midwives, and I'm very persistent. Like, I'm not shy. I will go at them. And I said, "What is this?" And they kept saying, "It's amniotic fluid." Then another nurse told me that it was just like build up of fluid from in her lungs when she'd been in the womb. And I didn't believe it. So in the end, they've sent us home after she was born on the Friday and we got sent home Saturday morning. And I had a terrible labour anyway. So I was already in a wheelchair because I couldn't walk after the labour. And the day we got home, the Saturday, she still had not drank a bottle at all. She had not passed a bowel movement since she'd been born. So they should not have discharged us whatsoever. And then when we got home, I was so paranoid I couldn't sleep because I thought, I've had another child before. I know that this is not normal, that she's not drinking at all. And then I was trying to convince myself maybe she's just a tired baby. The labour was a bit traumatic. Maybe she's just exhausted. I was trying to convince myself anyway. I knew deep down I was wrong. And then I didn't know that they did this anymore, but we had a midwife turn up on our door and she literally saved her life. And this midwife came, and I'll never forget her. She was the loveliest woman ever. And she came in, and I had kept a blanket that she kept throwing the green stuff upon. And I showed it to the midwife and I said, "She's still not drinking. She's not had a bowel movement. And this is what is coming up." And she said, "Go to Alder Hey, like now." So we went straight to Alder Hey and they just rushed us straight in. Now, I thought they're being cautious because she's a baby, but as we've got rushed in, all the surgeons were already there. So it was like they already had an idea from what I'd told them, like over the phone sort of thing. And they put an NG tube straight in to find out what the green stuff was coming out. And the bag fills up full within 5 minutes of like green bile, sort of, which was basically the obstruction. Anything that was going in was coming back up from a bowel. So the surgeon basically, he had a rough idea and he said, "I think she's got a bowel obstruction. We think it could be something called Hirschsprung's disease." So I'm like, I couldn't even spell it. My head was just gone. And then when we'd had a look online, I was like, "It's that." And I knew it was. I said to my mum and my sister, I said, "It's that." And he was like, "No, just can't, it might not be." And I said, "It is that. I know it is." And he said, "The only way for us to really find out is to operate. So we'll do open bowel surgery and we'll be able to have a look and see ourselves what it is." So they did that anyway in there and then. They put the stoma in because she had the obstruction and he knew what it was. So now at this point, they didn't remove any other bowel because they done biopsies and stuff and they wanted to see how bad the Hirschsprung's was. So they done the biopsies and they put the stoma in. Now, when she got back from the surgery, I was so like fulfilled. I didn't even know what was going on. Like, I'm delirious from the pain medication from labour. And I didn't even know that they put the stoma in. They did tell me, but like I was that all over the place. When they brought it back, I've seen this thing on her belly. So I've just went to move it like a piece of tissue and I moved it and it was a stoma. And I was like, oh my God, what is that? I didn't know what it was. And I was crying and everything. And then, yeah, that's when she got the stoma. And then the biopsies came back that she had long segments, which is, I think there's four nerves in the bowel, correct me if I'm wrong. I think it's around four major nerves in the bowel that you need to push things through. It's
Yeah.
roughly about that.
Yeah.
And basically, like three of hers was non working.
Yeah.
So it was very rare chance that she could cope without a stoma. And then I'm trying to think what happens from there. Basically, the stoma trained us in the hospital and stuff, and I got really overwhelmed. And the first 2 days, I couldn't do it. I was saying to them, I can't do it. Like, I don't understand it. I'd never seen anything like it. And he was saying, we can't let you go home until you've done it. So I had to learn it. And I'm like a pro at it now, but at the time, it was just terrifying, terrifying.
Yeah.
And then we got discharged, and then that was literally the only thing about Hirschsprungs we ever got spoke to about.
Wow. So
Yeah.
that's quite a whirlwind first, what, week or so. I would imagine you've
Yeah, it
gone
was
from,
horrendous. Yeah.
yeah. I mean, I have so much respect for mothers and parents who you go in to labor and you expect, things to be totally normal, and then within a week you are an expert in stoma care. You
Yeah, it's
have
bizarre.
It's
It is.
unbelievable.
It was a lot, yeah. And because usually when your baby's born, that first week is like the best because you're in like a bubble and it's all just exciting and new. And that week was probably, I'd say, the most traumatic week in my life that
Sure.
I've ever been through, as well as to the fact that I couldn't even walk and like I was in a wheelchair. So it was just, I was getting pushed around all day in a wheelchair. People thought I was the patient because I was in a wheelchair. It was so strange. Now I think back to it, it's like my brain has cut off some of the bad bits so that I don't remember, if like that makes sense.
Yeah, it's a trauma response.
Yeah, yeah,
Absolutely. Your
definitely.
your brain will, yeah, not that I'm an expert in this at all, but your brain will cut off certain bits that are incredibly
Yeah, because
traumatic.
some of it is blurry. I just remember like the important details, but then the bits in between, like the recovery from the surgery, I was on edge. That machine that was beeping is still engraved in my brain.
Yeah. And then there might well be, things that I've seen, I've heard happen to other people where you will completely forget about something for years and years and years, and then there'll be something that triggers it off, and you'll
Yeah,
remember it really, really clearly. So those bits that are quite fuzzy at the moment might end up just being really, really clear.
yeah.
And it could be the simplest thing that triggers that off.
The
But
beeping, the
yeah,
beeping for
yeah, yeah,
me.
yeah. If
So
you,
anytime we go to hospital now, which obviously can be quite frequent, I'm okay-ish until I hear that beeping, and then it's like my body goes into fight or flight, and I start shaking
yeah,
and I start sweating, and I have like panic attacks over that noise.
yeah, yeah. No, it makes absolute sense. But
Mm,
I can't imagine you'd watch many episodes of Casualty or Holby City.
no
That
way.
would that
I
would
won't
just
watch
be
anything health related now. I'm terrified.
no. I don't blame you at all. I don't blame you. The one thing that does really surprise me is that, and from correct me if I'm wrong, but the birth wasn't at Alder Hey, it was at another hospital,
Yeah,
and they discharged you without the bowel movement, with the not the, everyone knew at the time, but the green bile being thrown up as well.
yeah.
I'm amazed they were allowed to do that. Did they explain, or did you ask them why? Sort of after everything had sort of settled down a little bit.
So what happened was when we originally got to Old Today, you know the way wards have like ward sisters and I don't want to say the wrong word, but like that they're high up basically, aren't they? And
Yeah,
we had one come to see us, like a very senior high person in All Today. And she said, can I see the red book? Now the red book is where they check the stuff off. And she said, I'm ringing them. And she was like she was furious. And she basically rang the women's hospital herself and was like, a baby's nearly lost their life because you didn't do the like correct checks. Like it's a duty of care that you have failed. And I was just in so much shock at the time that I couldn't even like comprehend what had happened. And then I'd say about 2 months later, I did go down the legal route of medical negligence. And basically every solicitor I went to said the same thing. It's true, but it's frustrating. Basically, because no matter what would have happened, she had this disease regardless.
Right.
Because they haven't caused her to have it, they can get away with it basically. But whereas if she did lose her life, thank God she never, then something would only get done about it. But why does it take a baby to lose their life for something to be done? This could happen to someone else where someone else isn't as paranoid as me and they don't go to the hospital over the same thing I did, and their baby does have a bowel obstruction and passes away.
Yeah.
They should be held accountable. And I did put a formal complaint in, and they wanted me to go in that hospital to discuss it. But my trauma is based around my labour and what happened afterwards. And I will never in my life step foot in that hospital ever again in my life.
Yeah.
Alder Hey is different because they saved it and they're an amazing hospital. But the women's hospital, where I will never step foot in the hospital ever again in my life. And I will never have children after more children after what happens.
Yeah. Yeah. No, I don't blame you. It's so frustrating that the legal system is effectively
Yeah.
against you, or
And
certainly not on your
there's a lot
side.
of mums who I know who've been in not similar situations but worse, where their baby has passed away in the hospital due to their negligence, and nothing can get done about it because the NHS is just like underfunded and understaffed and all that. Which, so at the end of the day, whose fault is it? Because you can't blame the actual nurses in that moment because they're doing what they're advised to do,
Yeah.
which obviously is not a lot because they haven't got the funding for a lot. But at the same time, doing the proper checks, it doesn't cost any money to check a baby's bowel properly. It doesn't cost anything. It takes an extra of the 5 minutes out of your day. If they would have felt her bowel, they would have felt how distended it was and how swollen it was. And they would have knew there and then that something was wrong. And we could have got transferred straight from the women's hospital to Alder Hey, where instead they've sent us home. And that one night we had at home was so risky. And it was very lucky that she survived that one night
Yeah.
before us getting to that hospital.
Yeah. Most definitely. And I just think that's again 4,999 out of the 5,000 babies that are born,
Yeah.
will pass meconium. You won't won't worry about it. They will pass, but
Mm-hmm.
it's that one in 5,000 that, or there or thereabouts.
And they actually marked down that she did pass that. So
Yeah.
that's the bar movement, isn't it? Like they put down that she passed that. And when I got home and I checked it, and I told the midwife who came to the house, I said, she has not passed that. And she said, you need to go. Like right now, they should never have let you leave.
No, no, and thankfully the midwife knew that because again, like you said, if the midwife hadn't turned up,
I possibly would have left her,
yeah, yeah,
and it would have been disastrous. And that midwife genuinely saved her life. And that midwife also does a clinic in Alder Hey, so we do still see her sometimes. And I took her flowers and stuff afterwards because if she genuinely never turned up, and I didn't even know that she was coming, so if she never turned up or we weren't home, you
wow.
never know what could have happened.
Well, yeah, dread to think, but
Yeah,
it's yeah, but it's just it is negligence, and it is.
it is
Did you
definitely,
ever
yeah.
get like some sort of apology? Because
No.
obviously it's cut and dry as far as I see it. It's they were supposed to do X, they didn't do X. You
Hmm.
know, I mean, and it's there in black and white.
Yeah.
And so they wanted you to discuss it. Then
Yeah, so like they basically wouldn't move forward with the complaint unless I went in and formally spoke to them, which I'm not comfortable doing something when a lot of my trauma is based around what you did or didn't do.
yeah,
And I don't feel comfortable going in there and hearing an apology that just doesn't really mean anything, because you're probably going to do it to other mums in the future, because they get you in, have your baby, and they rush you back out. There's not enough aftercare. Even not even what she had when she was born. I was severely neglected after my labour. When I did get checked, they so I had something called an episiotomy, where they have to basically have to slice you to help forceps, and they sliced my leg without informing me. And when I seen that midwife, she checked me over, and there was a big slice on my leg, and that was the reason I couldn't walk, because it was an open wound rubbing on my other leg. And I put another complaint in about that. And I thought I couldn't walk just because of the labour, and it was because of the cut. And
No,
I also put that in the complaint. Nothing, no apology, nothing.
that's
It's
that's
horrendous,
awful.
yeah.
That's awful. Yeah, I
It
mean,
was
there's no other
horrendous.
word.
It was
There's
really
no
bad.
other word for it. That is. So not only do they not check for Hirschsprungs,
They didn't even
they
check
also
me.
just
And they
decide
never
to.
discharged me with any pain medication. My mum actually had to ring them the next day and say, you've discharged her with nothing. No painkillers. They told me to take paracetamol.
Oh, for a sliced leg.
Yeah, bad. It was. That's why I will never have any more children. And if I did, I wouldn't. I would not go to the hospital.
No, and fortunately, you are near a hospital that a lot. I speak to a lot of people that are at Alder Hey, and they constantly tell me how good it is. And I know it's Hirschsprung's specialist site.
Yeah, which is lucky
Um,
for us because like we live so close to them, and like if we lived in a different place and we went to a different hospital and they didn't know about Hirschsprung's disease, it could have gone missed again. Whereas we were so lucky that we had Mr. Taylor, who was our surgeon. He was the first surgeon that we seen, and he's still our surgeon now. And he was honestly amazing. He just knew straight away.
yeah, no, and that's really reassuring as well to know
Yeah.
that because there are a lot of people who maybe aren't based in Liverpool, but they do get sent to Alder Hey
Hmm.
because it is a specialist centre, and
Yeah.
if there's one thing they do know about, it
It's
is
Hirschsprung's.
Hirschsprung's.
Yeah. They definitely know a lot. Definitely, especially Mr. Taylor. To even be able to diagnose without even looking at the bowel or anything, he must be very on the ball with it.
Yeah, yeah, most definitely. And there's a lot of people there that, not just know how to diagnose, but also, like you said, the aftercare.
Hmm.
That's so important to me because
Yeah,
people
very.
think, oh, you're diagnosed with Hirschsprung's. And again, I see this a lot just online where people say, oh, you're diagnosed with Hirschsprung's, you had your surgery, you're now fixed in inverted commas. And
Yeah, definitely does not work like that.
no,
No
absolutely
way.
not.
No
Um,
way.
and they say, "Oh, well, you've had your surgery, you've had the pull through, and now everything's fixed and you're all okay." It's like it doesn't work like that. And especially, with having I think it's five different types of Hirschsprungs. There's
Hmm.
so many different types, and even two people with the same long segment won't have the same lives
Yeah,
or the same medical
it's
condition.
very different, isn't it? Like in terms of how a person can react to it. Someone can have a pull through and remove the stoma and be perfectly fine, whereas others can get a pull through and it's still not work for them,
Yeah,
and they end up needing to keep the stoma. We actually decided to keep Darla's stoma for the fact of, I'd say it was the year 2023, the year she was born. She had enterocolitis, which is a common bowel infection that you can get with Hirschsprung's disease. And they actually removed most of her bowel that was affected because that was what was causing the infection. But in the process of removing that, they've done the pull through, but they've kept the stoma. And then I basically did my own research to decide whether or not we wanted to try the pull through. I decided against. Basically, we found out that if you've got long segments and you've had the pull through, your bowel is very, very limited and small after a pull through if you've had most of your bowel removed. So for Darla to be able to go to the toilet, she could need to go to the toilet up to 20 times a day through to adult life, where she may need to wear nappies into the future in adult life. And I didn't see that as a way of life for a young girl. And I don't think a stoma limited in any way at all, only with a certain few foods that she can eat. Other than that, she's literally the happiest child you will ever see. And a lot of people said, well, are you not worried she'll get bullied? And I said, well, I'd be a lot more worried about her having to go to school in a nappy at the age of 12 instead of a stoma bag that can be concealed. No one can see it.
yeah,
It's very hidden and it's safer
yeah.
for her.
Yeah, no, I think again when you mention the word stoma to people, especially if you've
It's like
had
jump
no
scare, isn't it?
experience.
Like they
Oh
think, oh
yeah,
no, yeah.
yeah, and when you mention that to people, they go, oh no, I don't want a stoma. I don't want one of those.
Yeah.
And do everything they can to possibly avoid it. But actually, like you said, quality of life is everything.
It's over everything. It's such an like I was also a bit nervous about it. And one of my first thoughts was, what if she gets bullied? And then I thought, well, I'd rather her be alive than anything. I don't care about anything else as long as that she's alive. And she's just started nursery now. And there's also another little girl with Hirschsprung disease and a stoma in her nursery. Isn't that like so
No.
bizarre? So the nursery was already stoma trained, which is amazing. Like we found the best nursery ever. But to know that there's also another little girl with the same thing, so it's just
Wow.
it is rare. But then you just think like, how lucky is that there's another little girl in their situation.
That's amazing.
I know, it's good, isn't it? I couldn't believe when they told me, because when we started the nursery, they asked like what she got, and I said Hirschsprung disease, and I always say, do you want me to spell it for you, because no one can spell it. And she said, oh no, we can spell it. We've got another little girl in the next class with Hirschsprung disease. She also has a stoma, so they've been stoma trained.
I mean, what a stroke of luck.
I
I
know,
mean,
and it's literally 5 minutes away from our house, so it's like this girl must live in like our same like neighborhoods, and
yeah.
she's got the exact same thing for the exact same age. So when I said to you, we were in the hospital when she was first had surgery, and there was 4 other mums or 5 other mums with the same thing. She was one of them.
Oh,
Isn't
that's
that like,
amazing. So have you, I know there's like HIPAA laws and stuff like that that you can't discuss medical, um, or they can't give out medical information of people. But
yeah?
do you know this mum? Have you chatted to her
No,
about
so we've
her stuff?
actually never met. I've just seen
Right.
it in passing.
Oh,
I've
okay.
I've seen it in passing before,
Oh,
but we've not actually spoke.
but you know who she is?
Yeah, I know who
Ah,
she is, but we just like say hello sort of thing. Do you get what I
right.
mean?
Yeah, yeah, yeah. Ah, but that would be interesting because I wonder, would she know that you are also um, a mother with a Hirschsprung's child as well? And it'd be
That's what I
interesting.
mean. I think maybe, but then you never know, do you? Because I don't think you could even guess by looking at someone.
Oh no, no, absolutely not.
No way,
No,
which is
we,
strange to me because I always wondered what a stoma was.
yeah.
And
Well,
like,
there you go.
there's so many people now. Now that I started talking about it on my social media, there is so many people that I actually know in real life who've got one or have got to get one, and
Yeah,
it's actually more common than people think. But no one likes to talk about it for the simple fact it's to do with the bowel. It's one of them things that people shy away from.
it can be one of those taboo subjects
Yeah,
that it kind of. But I think it's becoming a lot more, like you said, with TikTok, with Instagram. You know, people are becoming a lot more open with,
yeah,
especially stoma bags as well. I mean, my
definitely, yeah.
Instagram is full of people who've got new stoma bags, want to show off the
There's
stoma
actually a woman
bags.
on TikTok called Stoma Babe, and one of my also worries was, do you know who she is?
She's just done the marathon, isn't she?
Yeah, so one of
Yeah.
my other worries was everyone was saying to me, like, what if she can never have kids? And then I found Stoma Babe, and she's
Yeah.
just had a baby, and
Yes.
while she's got a stoma. So I love watching her because she's stunning as well. And like,
Yeah.
you would not know just by looking at her that she's got a stoma. She's honestly stunning, and she's just a lovely person. She raises awareness about it as well, which I think's amazing. And I learned a lot of stuff just from watching her, and like different products that I've never heard of. I watched like, so I think TikTok is amazing for things like this because you learn a lot. This is
Oh
where
yeah.
I've learned most of my stuff from, TikTok.
Yeah. Yeah. And I think, hospitals will give you, little bits of information. They might, if you're very lucky, they might give you a leaflet.
No
But
way.
if you're lucky,
Yeah.
but they, and they'll give you all the physical info, how to do the washouts, how to do the this and that, and possibly some products to use. But actually, social media is, again, social media can be a minefield, and there's lots of misinformation on there, and there's lots
Yeah.
of, there's lots of everything, the good, the bad, everything. But so long as you follow the right people, and
You learn a lot.
oh,
You
you
learn a
do.
lot.
You really, really do. I mean, I've had TikTok for like a month or something. I barely started it.
It's
But
such a good
yeah,
platform for spreading information about, especially about health related stuff. It sounds mad, but people on TikTok seem to love it, and I think that's because they're very curious.
mm,
So when I didn't speak about my daughter having a stoma for a while on social media, and then I started getting a following. So now I've got 20,000 people. When I am starting to post vlogs and I mention the stoma, people are starting to comment like, oh, what's that? Like, what happened? And then that's when I ended up telling the story of what had happened. And it got a lot of attention, and a lot of people messaging me saying, they feel seen because their baby's got a stoma, and like other medical mums in the same situation that feel like they don't get enough help. And that's another good thing
Yeah.
that I love social media for,
Yeah.
making other people in my situation feel seen.
Yeah, that is so important. I'm glad you brought that up as well because it's it can be, especially if you have a child or you have a condition yourself, or a child with a condition that is really rare. You know, you
Yeah.
type in Hirschsprungs or mention the word Hirschsprungs just to 99% of people, and they'll go, "What?" I mean,
What?
even
Yeah. What's
healthcare
that? Yeah.
professionals, even the amount of GPs that I've ended up having to explain
Oh
what
yeah. So
my condition is.
when the baby was poorly last week, we had to get an ambulance, and there was so two ambulance men and then a student paramedic with him. Not one of them knew what it was. And he was sitting there on the iPad on the way to the hospital, like researching. He was like, it's so interesting that he said you learn something new on this job every single day. But he said he'd never heard of that. And I think he'd been 50 years he'd been doing it for. He was 40 years maybe. He started when he was about 20. He was a quite older man. And he said, all my years, he said, I've never heard of it in my life.
That's that's surprising, especially being so close to Alder Hey and
Yeah.
being that's yeah, that's peculiar.
And because I was explaining to him, and he said, it sounds familiar. He said, but I've never heard of it before. He said, we've dealt with people with stomas, but never with Hirschsprung's disease.
No. And that's the thing, like when we said about community, about because you can feel a bit isolated
Yeah,
when
definitely.
you have a child with this condition and nobody's really heard of it and friends have never heard of it and
Yeah.
even wider family have never heard of it, and
Hmm.
you feel like you're spending the entire time having to explain,
Explain. Yeah.
yeah, well, it's this and it's that, and they have a stoma and
I'm
the
constantly
bowel.
Googling. I feel like I am constantly Googling. If I want to give a something new to eat, I won't. I Google, and all I feel like I do is research constantly because I'm so paranoid to give her something that she's not allowed. And then if we do, I'm like, do we need to go to the hospital? So I'm always like on edge, and then I don't like leaving her with other people in case they give her something that she's not allowed.
Yeah,
You're just always on edge, and going new places like going to the swimming baths is a big anxiety for me, and I won't really go because I feel like people are going to be looking like because she's got a stoma, they don't feel comfortable with her being in the pool with them. Just things like that. But you just never know what people are thinking.
yeah, I think as well it is difficult because I think all of us kind of, we always try and second guess what other people are thinking,
Hmm.
when chances are most of the time they're just worried about what they're doing.
Yeah, that's one of my big things. I am a big overthinker.
Yeah, yeah, but that again, going back to your original point, about anxiety and medical anxiety and medical trauma, I think that's, again, speaking to so many people who go through the diagnosis of Hirschsprung's, who
They
have
all
a
feel the
child with
same.
stoma, they your story is one that I have heard, before, where people they do they do it's sort of a, and I don't think it's a too strong a word, PTSD.
Oh,
And
definitely. So I actually got diagnosed with PTSD
yeah,
not long after because I was having nightmares and I couldn't settle. And then eventually, only last year, so she was actually one at this point, it turned into panic disorder. And then my panic disorder turned into agoraphobia. And I didn't leave the house for 2, 3 months.
wow,
I couldn't even walk to the top of the street. And that was solely because I was so worried that either she'd have a bowel obstruction and pass away, or that I'd collapse and pass away. And then who's going to look after her with their stoma? Do you know what I mean? So it was all health related that kicked it off. And it was PTSD, panic disorder, everything. I did eventually get past it, but going to hospitals or when she gets poorly, I will do anything to avoid going to the hospital because it triggers me that bad. I will only go if I know that we really need to.
Yeah.
And I don't think there's any help at all. Well, for new mums, I don't think there's any help at all for the anxiety you get after giving birth. But if you're a medical mum and you've just given birth to a baby with a disease like that, there's no support at all. Especially like when we were in the hospital, I feel like they should offer a counsellor for if your baby's just nearly lost life and has had to have all these procedures and stuff and is a newborn baby and you're a new mum. I think there should be a counsellor in the hospital that can go and spend an hour with these mums and speak to them and see how they're feeling and see if they can help in any way. Because putting a mum in that situation after just giving birth and then all of this happening, for one, you can't think straight. For two, you're so scared, you literally can't function, but you're trying. You don't want to sit there crying in a hospital room when the nurses are coming in and out because you don't want people to keep saying, "Are you okay? Are you okay?" Because that triggers you worse, yeah.
Yeah.
And I used to go into the bathroom and cry in Alder Hey because I used to think I don't want people coming in and out and asking if I'm okay when she's literally lying on the hospital bed. Do you know what I mean? Just had surgery. She's a day old. And
Yeah.
yeah, it was just horrendous. But I
But
did get over it and now I can just go out freely and stuff like that. And that was because of therapy. I did end up needing therapy for it.
yeah, I think you're right, and I advocate for this a lot. Where you, as a mother, I presume you are then thinking, I just want my child to be okay, but actually,
Yeah,
who's taking care of you?
that's the thing. Yeah. And I feel like this might sound a little bit selfish to say, but I know that mums will relate to it. Don't care saying it. When we was in the hospital and the baby's poorly, everyone's coming to see the baby and forgetting about me, even though I'm in a wheelchair, I'm in severe agony and I'm traumatized, thinking that I've just nearly lost my newborn baby. And I felt like no one really, but at the same time, I was glad that everyone was cared about the baby. But then at the same time, no one was looking after me. I was looking after myself, and I weren't doing a very good job of it because I was, traumatized.
Yeah, and I think I had spoke to somebody about this a couple of weeks ago, where they said, you know, in order for me to look after my child, I need to make sure that I'm okay. You know,
100%, yeah.
and then it is that, who's going to be making sure that I'm all right.
Yeah.
And I think it's something that is, it's like you said, with no immediate support offered to you, and you've gone through a pretty, I mean, very hectic, traumatic um experience.
Yeah.
And it's then going, right, okay, how do we support everybody? Because obviously your child needs lots of support, but you need that support as well.
Exactly. And I
Uh,
do think that they should, even a volunteer, I'd love to do it. But then I feel like would people take it serious? If you just go to the hospital and if a mum with a newborn baby has just had something happen, someone could just go in and say, I'm here if you want to speak for an hour. And if you then if the person who's helping them with the counselling feels like they need further help, then maybe they can refer them for that. And I think that should be done earlier rather than later, and then it wouldn't have ended up like I did with agoraphobia. If I would have got the help that I needed at the time, the stuff that happened to me a year later wouldn't have happened because I would have been resolving them issues already instead of letting them brew up
yeah,
and it all hit me at once.
yeah, definitely. And I think you'd be a perfect person to go along because
I'm a good talker.
but you've been through it.
Yeah,
You can,
relate.
again,
Yeah.
it's one thing hearing it from somebody who, might be qualified
Hmm.
and might be able to talk through various symptoms and whatever that you're experiencing, but it's
Hmm.
entirely different when you talk to somebody who has been through something similar,
Yeah.
because they know, and you can't replicate that.
No, definitely not.
You can't replicate the all of the feelings. It's like we said before, all of the feelings that you went through, some of
Hmm.
which obviously you blocked off and then come back in,
Yeah,
spurts and
and that's
whatever.
exactly what it does. That's why now if I'm upset about something, I'll let myself feel it in that moment instead of it coming back round and biting me. Because when it comes back round again, it's doubled up because you've left it for that long. And it's strange because I know if I would have asked for help at that time, I wouldn't have the anxiety that I've got now, which is rootless.
Yeah, but 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 then obviously the flip side is that you're going through anything and everything and worrying entirely about your child.
Hmm.
So you probably didn't have, as you said, had everything going on, a very blurry memory of everything. You probably
Yeah,
then didn't think, oh, actually, maybe I need to possibly have some help because you're just
yeah,
not
you just don't
thinking
think
straight
about
at
it.
that time. So it's impossible for you then to go, oh, actually, I might need to do this, that, the other. That's where it's kind of you need that other person, don't you? I guess someone else to kind of go,
Yeah, definitely, and especially when you get discharged, that's a whole other ball game. Getting discharged and like sent home with all this information and all these medical equipment, and I remember getting home and I was just like, oh my god, like there's no one here to help me now. There's no nurses. Like I need to be on the ball, yeah. And I remember the first few nights I struggled a lot because the bag kept leaking and I couldn't understand why. And it was because I was so tired. I weren't like putting the stickers around the bag and it was just exploding everywhere. And we were going through clothes, like there was no tomorrow blankets. It was a nightmare. Obviously, I'm like a pro now. Like I could do it with my eyes closed and have no issues. But at that time, I remember I cried for like a week straight because I kept thinking like, am I doing it wrong? Am I hurting her? When obviously it doesn't hurt. It doesn't hurt. But I was so convinced that I was like hurting her.
yeah, yeah. But it's interesting that you said that you've become, it's just second nature to you now. And it's
Yeah,
amazing what you can
definitely.
become qualified in
Yeah,
something that you haven't known for many, many years, and then suddenly because you effectively you have to,
yeah.
you
It's like you've
become
got no choice, which is
no,
actually a good thing because it shows how resilient mums are. That if you're given something and you've never done it before, and you know you've got to do that for your child, you just do it.
yeah, absolutely. There was one other part that you mentioned as well, when it was just before the midwife came round, and you knew something was up,
Yeah,
even though everything had been ticked off and you'd been sent home and all of this stuff. And there's one thing I'll always believe in, advocate for, having spoken to
mother's intuition.
exactly. That's
Yeah, always.
exactly what I was going to say. But mother's intuition, if I can say it properly,
Yeah,
um, is is just something that I can't explain. I don't know if anybody else can explain it better than I can, but it's something that I presume you just feel
you
rather
get like
than
it's like you get like an instinct in your body. So obviously, my eldest daughter, she's been to Alder Hey once in her life, and that was because she's had an abscess. She's never ill. She never had any health problems. So for all I knew, that was normal. But it was just I had this thing in the back of my brain, and it was like a voice, and it was just saying something's wrong, something's wrong. But then there's another voice trying to convince myself, no, you're being paranoid now, you're being paranoid. But I knew for the simple fact she weren't even waking up for a bottle. She'd slept all night without a bottle, and I'm like, that's not normal. Like she would wake up for a bottle now. But I feel like obviously when you have a baby, you're like intertwined with this baby anyway. They've just been inside you for 9 months. Like it's so hard to explain, but you just know. Like every time I've had a feeling about something to do with my kids, I've never been wrong.
yes. I think
Every
that
time she's
that's
been poorly since she's had the stoma, everyone's like, oh, she might not be that bad. And every time we've ended up in hospital, like I've said we would, and we've ended up staying in for a week at a time because I knew. And I am not on the ball with it now. I can notice 3 days before she actually gets poorly that she's going to be poorly just
wow.
by how she acts and certain little things she does.
Wow. I mean that's yeah, that goes far and beyond mother's instinct. That's kind of
Yeah.
telepathy stuff.
Yeah, I think I am a little bit telepathic.
But that's but it's something that I will always advocate for. It happened to me 30 odd years ago, and if my mum hadn't had brilliant mother's instinct, then I wouldn't be here.
Yeah.
So it's something that you can't explain, or certainly I can't, but it is that feeling of you just know something wrong. And it's interesting you said, every time I just know, and every
Yeah.
time I've been right. And I
And that's
think,
why when you do go to the hospital now, and obviously most of the doctors there do know Darla and know about Darla's situation, but like when we get new doctors or like new nurses, when we go to A&E, I say to them, I know there's something wrong. And they say, we always trust mother's intuition, especially if she's got a medical background and the mum says something's wrong. She said, we don't even really listen to other doctors. We'll listen to the mum. And if the mum says there's something wrong, 9 times out of 10, there's something wrong. And every time I've said it, there was something wrong.
Yeah. I mean, I'd probably go even further and probably say 99 times out of 100.
Yeah, honestly, every
I
single time. I
yeah.
remember this when she did have to get a bile removed the second time when they did the pull through. That was the second operation. After that operation, she was acting strange, and I said to them, "There's something wrong with her." And I shouted all the nurses in, and 2 minutes later, she went like floppy. And turns out she had sepsis and needed a blood transfusion. But it was just off me looking at it off the off chance and noticed that something was wrong. And it was because she was staring into space, and I shouted all the nurses and I said, something's wrong with her. And he
Mm.
said, no, I think she's just, a bit swollen after surgery. And I said, there's something wrong. And 2 minutes later, she was like unresponsive, but all the sats were normal. It was strange, but she was like unresponsive and
Yeah.
went grey and she needs the blood transfusion. And it was like, I just knew.
Wow. That's I mean, so she's gone through enterocolitis and sepsis. So two of like the
She's had
main.
sepsis about 2, 3 times now, yeah.
Wow.
I think they said once you get sepsis, you can be more prone to get it again, especially off
Right.
enterocolitis. So now
Okay.
every time we go in, she gets sepsis queried because she's had it so many times.
Yeah. No, that makes sense that you are going to be more
Prone
prone
to
to
it,
it
yeah.
than previous. But yeah,
Mm-hmm.
I mean, so she has had all of the I guess more well-known
Yeah,
associated conditions with Hirschsprungs.
yeah.
So it's just bad luck that you've ended up catching them all, I guess.
I know. Terrible
That's
look.
that is, and as we've just sort of got 5 or 10 minutes here. In terms of the future for Darla,
Hmm.
I know you mentioned she has stoma and will keep that stoma.
Yeah.
What do you see her sort of future looking like medically and non-medically?
So medically, I have basically said if when she gets older, she decides she wants to do the reversal, she can do that completely. She can do that, and I will help her and whatever. But I want her to be able to decide that on her own with knowing the pros and the cons of it. I don't want to put her through it now and put her in a worse situation than she's already been in. She's been through a lot. I don't want to put her through anything else. So if when she gets older and she decides she wants to do it, that's perfectly fine. And then if she decides she wants to put back in, that's fine. She can do all that. But non-medically, I haven't even thought that far ahead. I can't even think about next week yet. I'm like, I'm moving at like 100 miles an hour I'm trying to get through the day. Never mind thinking about the future. But I just know she's just like the funniest kid ever. So a comedian probably. I could just imagine her to be a comedian. But
Yeah.
I want to raise awareness about what she's got, and like I want it to be known as like this resilient kid who's been through the worst stuff in the world and has come out 10 times better, for people who are scared, who are in this situation, to look up to someone and say she's been through it and she's fine, like I do with that stoma babe on TikTok.
Yes.
That I look up to her like that. So I do want to raise awareness and help other people in the same situation
Yeah. Well, I think
because
you
of
do
her.
you do a fantastic job of that. I mean, it's how I came across you in the first sense,
Yeah,
TikTok. I think you do a great job
thank
in
you.
raising awareness. Because again, as we said, it's not it's not something that's talked about as much.
No, definitely not.
And it's difficult for me to say whether it is talked about more or it isn't because I'm in that bubble every day. So
Yeah,
and I guess you're sort of in that bubble as well.
yeah,
Um, so and where we just sort of come across it because it's what we search for, it's who we follow and
yeah,
all of that stuff. But it is about sort of raising that awareness and also not being afraid of it. I think as we said before with stomas people can kind of go, "Oh, stoma,
yeah. They
don't
don't want
like
to talk
that."
about it, or they think it's embarrassing, or because it's anything to do with bodily fluids, people are so weirded out by. And it's like, come on, we all have bodily fluids. How do you think we
Yeah,
survive? Basically, if I'm telling you that if my daughter couldn't go to the toilet, she would have lost her life. How are people not understanding how important bodily fluids are? Like,
yeah,
it's a part of the body's system of like regulating and functioning. You know
Yeah,
what I mean? But
exactly.
people, I think people just shy away from it, don't they?
Yeah. Yeah, absolutely. But then the more we talk about it, the more normal it becomes,
Yeah, definitely.
and also it might save a life. People might be scrolling across and going, "Oh, actually, this person said this, and oh, I have that, and
Exactly. Or
that's
like if
not
someone
normal."
seen my video and their baby had just been born and they're vomiting green stuff, and they did believe the doctors when they said that it's fluids from the womb.
Yeah.
But then they seen my video and tested against that, and it was right.
Well,
You
there you
know,
go.
it could save a baby's life.
Yeah, you've already saved a life. Just and it
Yeah,
sounds it sounds silly to go, "Oh, well, I did a TikTok and saved a life," but you do.
you genuinely can. Yeah.
You
And that's
really,
why I take TikTok so serious now. I never used to take it serious. I used to just think it was just like, a little app. And now I've got 20,000 followers on there and I've met some amazing people. I've got some amazing opportunities and like things like this, I would never ever have done. But all this stemmed from what happened to her when she was born because it's given me the confidence to do everything that I do now.
yeah, yeah, and that's a fantastic sentiment to finish on because you said, through adversity has come all of this strength that you
Positive
didn't know you
things, yeah.
had, and all of this confidence, and all of these things. You wouldn't have thought, a few years ago you'd be an expert at stoma changing and expert in
Exactly, yeah.
Hirschsprungs and all of these things that you've acquired over the last few years. Has been absolutely amazing, and all power to you for that, 'cause that's fantastic.
Thank you.
And just as we finish, where can people find you online?
So I don't really use Instagram. I only use TikTok, and my TikTok name is Libby Gale Mum. Now that's what everyone calls me, but I think my TikTok name is actually just L Darcy, which is Libby for my name, and then Darcy is my eldest daughter. I made the TikTok account like 8 years ago, maybe. But my TikTok name is Libby Gale Mum.
Fantastic. Well, go and have a follow if you want to see lots of sort of. There's some really good sort of Hirschsprungs. Your story is on there as well. I think it's
Yeah.
just a 5-minute story on there. But that's really really good. So thank you so much for coming on. It has
Oh,
been a
thank
it's
you.
been a pleasure to chat to you.
Yeah, it's been amazing. Thank you.